If they have the study permit, then they have to apply for BC Healthcare. Next. Okay, now let's talk about your plan. Your plan covers you as students. It covers your dependents, that is your spouse, your children, and it also covers accompanying persons. That's all I have to say on that. Very, very, very simple. When does your coverage start? Well, as you know, you got your cards. It starts February 1st. When does it end? It ends when you're no longer a sponsored student by the Cultural Bureau. What the Cultural Bureau does is that we exchange data on a regular basis. We're now doing it almost every second day. So when you're no longer on their database, it comes to us, your card is terminated. So even if you presented your card, it would not be recognized. That's it. All right, the important thing, what coverage do I have? So in other words, what can I use the card for? You could use the card for 3 different levels of coverage: basic care, supplementary health care, and dental. Now, the basic health care is the care that you get through BC Medical Services Plan. That means hospitals, doctors, lab tests. You use your BC healthcare card. So let's see what that means, just so that you know, in case you have any questions as what basic care is about. So next slide, Maestro. Thank you. So the first one, in terms of coverage, is what we call outpatient, which means emergency rooms. So you have an accident, you cut your hand, you have to go to the emergency room. That's covered. You go for a one-day surgery, because sometimes you just present yourself to the hospital, you're there for one day, you're released right away, and you're sent home. That's what they call outpatient. But that's covered by BC Healthcare. Next. The next one, you could be admitted into the hospital. So if you're admitted into the hospital, you need surgery, you need to be put in intensive care. If you have a dependent, and that person, the baby, the child has to be put in intensive care. Nursing, drugs, tests, all the services in the hospital are covered. But again, that's with BC Healthcare. Unless you're in your waiting period, then it's covered under your plan. You're also covered for doctor's visits, specialists. So if you need to see them, they're also covered. Now, supplementary health care. Now let me find myself in my notes. Supplementary health care. So the next slide, please. So for supplementary health care, all the benefits I'm going to describe, they're reimbursed at 100%. There's no deductible. That means there's nothing that's held back or something that you have to pay and you don't get reimbursed. And you have a maximum of $1 million. Now, believe me, it would take a lot of services for you to consume to get to $1 million. So I wouldn't worry too much about that maximum and how it applies to you. The first coverage that you have under your, I'll take that card out, under this card, is drugs. Drugs is very important because you never know when you may need it. You may need it, you go see a doctor, you have a flu, you've got a virus, you need antibiotics, you will need this for drugs. Now, what's covered in the drugstore? I'll make this very easy. If you've ever been in the drugstore, there's the back part where the pharmacist is and they're working. Those drugs that are behind, those are the drugs that are reimbursed under your plan. All the drugs in front of that counter are not reimbursed. So even if the doctor gives you a prescription for aspirin, no, that will not be covered. Aspirin, you can go buy it on the counter. You don't need a prescription for that. Only drugs that you absolutely need a prescription for are covered. The pharmacist knows what to do with the card. There are codes on the card that the pharmacist knows. They just enter those codes in. The drug goes right through the system. That's it. There's no bill to you. It just goes straight through. I'm sure some of you have already used it.
Do I have to pay now at the pharmacy?
No. It just goes through. Now, the drugs are also reimbursed on what we call a generic equivalent basis. So drugs, there's a brand name drug, and sometimes there's what we call a generic. If a generic exists, you'll be prescribed a generic drug, not the brand name drug. That's what we'll pay for. But you're getting the same drug. So that's not the question. It's just that it's cheaper than the brand name drug. Next slide. Some drugs, some very expensive drugs, and drugs that are very, very particular. For example, if someone is suffering from cancer and is released from the hospital, they're prescribed drugs to help them cope with their cancer. Some of those drugs are very expensive, and expensive like $50,000 a year. Those drugs have to be authorized by us first. We have to say yes before you can get them. But your pharmacist will know that, because when he uses or she uses the card, they will get a message and saying, oh, you need authorization, and they'll help you with the process in getting that authorization. So you'll get a message, they'll tell you what to do, just so that you know. But I would say for 99% of you, that will never happen. But it may happen if you are suffering from a very specific disease or you're very sick. So just so you know. I have to be a movie star. Now I gotta hold so many things. When you get your drug claim, you'll be given a 30-day supply of drugs, just so you know. However, if you're suffering from a disease, let's say you have asthma, and if you have asthma, then obviously you need your medication all the time. At that time, you can get 3 months supply rather than just a month. Just so that you know that these are the limits that you have when you go get your drugs. Any questions on that? All right, next slide. Oh. Next slide, sorry. Yeah.
Excuse me. There's a question just came asking about why should we pay in cash for some medical centers instead of if it's not covered by BC and we present our new medical insurance and they will not accept it, they will ask us to pay in cash.
Yeah.
Could you please just...
Okay. The question that we have is, why is it that for certain medical services we got to pay up front and we can't just have the provider bill us directly? And that's a very good question because we get it everywhere. In the Canadian medical system, the professionals that are providing you a service, such as a medical doctor, they can charge what they want outside of BC healthcare. We have no control over that. And we can't tell them what to bill, and we can't tell them how to bill it. The practice of a number of clinics, and we visited a few, is that they don't want to deal with any provider. They say, I'm sorry, all our patients pay, they then will have to make their claim to their provider. So it's not a question of not accepting the card, or they don't accept Saudi students, or it's just a question of, doesn't matter who you are, this is their practice. The same would happen with dentists. I don't know if some of you have used your card for dentists, but I can tell you that some dentists, doesn't matter any patient that they have, you pay them. They'll send your claim, they'll do that for you, but that's it. You have to pay them. So it's not a question of, we can't get this done, or it's because your card isn't good. It's a matter of, these professionals have decided it doesn't matter who you are, you pay me first. And then you send your claim. So you will come up against that, and unfortunately, that's what you'll have to do. Now, let me qualify that, because we're working very hard to try to get providers to bill us directly. I'll give you an example of even yesterday in Kamloops. We had a student who needs a hearing aid. It was a $3,000 hearing aid. Doesn't have the money to pay for $3,000, and after that send us the bill. So we asked him, says, who is your provider? Who is the hearing aid center? He gave us the name of the hearing aid center. We contacted them today, and they're billing us directly. So when you come up to those situations, I encourage you to call us and say, here's my situation, here's my provider, is it possible to make an arrangement with that provider? We may not be able to do it every time, but if you tell us, we have a chance to happen. Because when we call them and say, we'll pay you, they sometimes say, oh, well, that's very good, then now I'll do that. That's fine with me. And it works. So just keep that in mind when you come to that situation. Does that answer your question?
Yes, thank you.
Okay. The next benefit you have is up there, is a list of medical services. It's a very short list. It's not meant to cover all the services that are available. On the website, there's this booklet. It has all the details. I'm not going to go through it all because we'd be here all night, and I don't think you'd be very interested. But it's there for you. So if you have a question, you're saying, well, I need this. I need a crutch. You know, I'm in the hospital. I sprained my ankle. I now need crutches. Is that covered? Well, look in the book. It will tell you whether it's covered or not. And crutches are covered, just so that you know. So I won't go over the list. It's just there to give you an idea of what's available.
There's a question about the LASIK eye correction.
Yes.
Is it covered?
No. Sorry. The question is laser eye surgery covered? It is not covered. Next slide. You're also covered for paramedical services. These are practitioners such as chiropractors, osteopaths, physiotherapists, psychologists, massage therapists, and the list is all there. Those are the practitioners. But they all have a maximum. So if you want to go to a massage therapist, you can go up to, you spend $500 in a year. Once this $500 has been reached, then you don't have any other coverage. I mean, you can continue going, but now it's out of your pocket. I had the question earlier, do you need a prescription to go see these practitioners? No, you do not. So you can go to them directly.
But those whom are authorized, right?
Yes, the practitioners all have to be authorized. That means they have to be recognized by the BC. So if it's a chiropractor, they have to be recognized by the BC Chiropractic Association. If they're a massage therapist, they have to be a member of the BC Association of Massage Therapists. So, but in most cases, they are. And if you're not sure, just ask. They'll tell you.
This is just a question about FlexMap, which is kind of medicine. It's really expensive, called FlexMap. Is that for rheumatism? I don't know. Is it a correct word?
The question is, there's a drug named, is it a drug named Flex now?
Yeah.
And is it covered? I don't know. I've never heard